lower limb function had deteriorated greatly. It became apparent that Jason, against our clear instructions, had failed to exercise his lower limbs and had continued to be wheelchair-bound throughout most of the day because he was embarrassed to walk in front of his peers. At this stage, he was unable to rise from a lying position and actually could only get around on all fours, utilizing his newly increased arm strength. Intense psychotherapy was instituted and he agreed to walk on a daily basis.
You have to get a psychotherapist to work with him.
We now see him ambulated and able to walk fairly freely. In addition, his Gowers maneuver was less marked. The patient was monitored on a yearly basis and each year video records were obtained. The most recent increase in muscle mass of his lower limbs as well as his upper limbs. He remains very thin with a marked lordosis and marked waddling gait. He is able to walk a kilometre without difficulty and does not use the wheelchair at all. He walks with the full plantar surface of his feet touching the ground, including the heels. He is able to pick up objects from the floor from a standing position without difficulty. His Gowers maneuver is still present, but considerably less marked. He is able to walk comfortably on a treadmill and to get on and off the treadmill without holding on.
I tried to get him to put in a gastrostomy, but he refused.
Okay.
This is a 2-year-old who was referred and he had already a lot of difficulty getting up. This is a mother. This is the one that I told you, the special mother. And he started at 4 years of age. Now he's about 12. He gets up and down, walks up the stairs without holding on now.
Come on down.
Delightful child. And now he just got married. That was the photo of him. This is him at about 17 or 18. Not holding on. Muscle mass, very good. Very compliant. He went to college and put up his drip every night, attached it to his catheter, and this is him at 20 or 21.
All right, good. Now, Vincent, just again.
That's his little brother shouting in the back there, "Get up!" This is him. Now you understand why I had doubts about the diagnosis of this kid.
Off you dance.
He loves dancing. This is the younger brother. At age 12 or so.
Okay, great, great, okay. See if I can work through this.
The accident, this is a 7-year-old. She had severe Pompe disease, had to be wheeled around, and she fell from
a vein that has a clot
her chair and hit her head.
But there was a blood clot in it. Hay una vena que tiene un coágulo de sangre. It's not, and it's not clear if that's something that's always been there, because that's possible, or if it was a result of the injury.
The parents came, the family came from Venezuela.
Can you put your chin to your chest?
These photos were taken
If I
by
take your
the
hand
father.
and lift you forward, I just want to see what your head does, okay?
She was at Washington Children's Hospital 2 days after she fell. no resistance at all to down pressure or up pressure and so on.
Down. Okay. Up. Down.
Father contacted me, it happened on Saturday, contacted me on Monday. Put her on tube feeding, and within 24 hours she was sitting up. That's just over the tube, and the father, really very observant man, and just photographed what was giving her all the energy. She has ptosis of the left eye. She left our hospital about 3 or 4 days later, walking. She has talipes because of weak ankles and so on, but here she is walking. A week earlier, she was just completely hypotonic. This is 2 months later. New Year's Eve. So that's the story. I'm going to come back to the other question that we had about adult patients. Somewhere here, but it'll take a while to find it. One of our patients came to us at 25 years of age. She had had symptoms of diarrhea and loose bowel movements on and off since she was about 18, on and off, and nobody knew what it was, and she had elevated transaminase levels, and they felt that, okay, she's got some liver dysfunction and so on, and they did a liver biopsy at 24, and when they did the liver biopsy, it was completely normal, hepatic function. But as they took it, they nipped a little bit of skeletal muscle in the same, and in the skeletal muscle there was autophagic vacuoles, and they were actually able to see glycogen and autophagic vacuoles, and they made the diagnosis of Pompe disease. And they, she contacted me, as most patients do, independently. They do it through their own contact precision. They contact each other, and then they get in touch and so on. And then she came, and they told her there's nothing that can be done, and Slonim doesn't have anything else, and so on. She came, and I looked at her. She was 5'10" tall, which is whatever it is, and 91 pounds, which whatever it is, and that's very low. The weight was very low, and I'm about 5'8" or something, and she was 5'10", and I weigh more than 91 pounds, I can tell you. I told her that she's got to have a gastroscopy, and she's really got to be fed overnight because she's just not going to get better. And she refused because she said, I can't, there's no way that I'm going to do it. I'm getting married in 6 months, and I'm not going to get a gastroscopy before I get married, and forget about it. I said, okay, you go home and come back in 3 months and we'll see how you're doing. She came back in 3 months. She gained about a pound. I said, you need a gastroscopy. She agreed to have a gastroscopy, and that's what I was looking at for in the other slide. She now is 10 years later. She now weighs 135 pounds, and she's working. My wife and I went out to where they live to visit them and so on, how they're doing, and there's a lot of hills up we couldn't keep up with her. She just was going up and down and so on. 6 months ago, she had a baby, a little boy, and she did extremely well and so on. So it can apply to adults. We have adults who really stabilize. I think that one can say that that's the most effective aspect of it. You asked a question, somebody?
I just asked if you treat your patients with this diet and also with the enzyme.
Oh, right. So as I was saying, I really leave it to what is going on at the time. For instance, if they're out in Nevada and or in California or something, and they are under the care of that doctor, they're not in New York, and I don't think it's helpful to get into a confrontation with their therapeutic doctor and say, okay, you've got to stop the treatment and start this and so on. I think that enzyme, from what I'm gathering from patients, is that enzyme is actually helpful. If you can get this conglomeration and accumulation of glycogen in the lysosome and at the receptor center where it blocks everything coming in, and because it blocks it, you end up with more and more autophagic vacuoles, because it's like they're fasting every 3 to 4 hours and they're saying, I need more and more nutrition, otherwise I've got to break down protein. And that's what happens. Like we saw in that 3-year-old, the level went from alanine from 192 down to 52. You know, that's bad. So that means that that's coming from skeletal muscle, and that's bad. So the most important thing is to convince them to put them on the nutrition, the overnight nutrition, every 3 hours and during the day as well. But the tube feeding is overnight. They go to sleep and it's fine. And then, you know, our oldest patient, the 26-year-old, he's had it since he was 4 years old. And just went to school, went to university. Every night he did it, and it's fine. By the way, those two brothers are not on enzyme. The two brothers that were in the movie, they're not on enzyme. The others are continuing to be on enzyme.
As a summary, I think one of the questions would be for you, if you could tell us the estimation of the percentage of patients who, being compliant with the diet, respond to this kind of therapy. In other words, whether this is 100% patients, this is 50, 70%, this is just an estimation. And also, of those who respond, if they are mainly on enzyme or they are equally responders without being on enzyme replacement, I think we would like to know that type of answer.
I don't know if I can answer fully, but I can only answer from our observation. Now, the two brothers have not been on enzyme. Actually, the older brother I put on enzyme. He had a severe reaction. He had laryngeal stress and had to be admitted to hospital. I didn't put him on enzyme, but they wanted to put him on enzyme. He lives up near Boston. I said, go ahead and try it. And he had a stress situation, and they had to admit him to hospital and give him steroids and so on, and we haven't put him on. And that happens to about, not as severe, sometimes more severe, but about 5 to 10% of patients have a reaction where they can't go onto enzyme. And because the dose is very high, the normal dose when we started with enzyme replacement was 1 milligram per kilogram or 2 milligrams per kilogram. Now we're at 20 milligrams per kilogram, and that's a huge dose which a lot of patients can't respond. The younger brother was never on enzyme, and he's dancing. We have the little girl that you saw there in New Year's Eve, where she was dancing. She's been on enzyme. It's been very beneficial to her, I think, before we saw her, but not beneficial enough. And now she's on combination, and I don't see any contraindication. I think it's fine. But I think that it's important to start off and see what your nutrition and exercise is doing for your patient before you put on both therapies together, because you can't evaluate otherwise, which is not unique to Pompe. It's to any condition. You don't want to put patients onto two types of therapy and not knowing, which is beneficial and which is not.
Thank you very much.
Sorry, there was a question of you. Oh, okay.
Another question is, do you have any experience with other types of autophagic myopathies?
Of which?
Other myopathies with autophagy.
Without?
Other muscle disorders with autophagy.
In
Dannon's disease, for instance.
Of
Dannon's disease.
Dannon's disease.
Do you have any?
Very good question.
Mm-hmm.
I had a 16, 17-year-old patient with Dannon's, and I tried to put him on our therapy. And he was being looked after by somebody in the Midwest who does cardiac, I've forgotten, surgery and so on. And I said, look, just let's do this for 6 months or a year. And they didn't want to do it, and they went off for surgery, and that child died 2 years later, and so on. I've tried to get some Dannon's patients. There's a patient in Canada. I think that it's going to be very effective. Enzyme, and not enzyme, but nutrition and exercise. But Dannon's is much rarer, but the concept is very much the same.
Can I comment on this? Because there is another muscle disease where autophagy or mitophagy is important, and it's the collagen 6 related defects. So it was shown about a couple of years ago that autophagy of mitochondria, which are abnormal, is defective. So there isn't enough autophagy. And there is a mouse model which is knockout of collagen 6. So if you put these mice on a high protein diet and increase the autophagy, their muscle function improves. And Ulrich disease is much more common, I think, than some of these diseases. So at least you might be able, in a way, it might be interesting to see in this group of patients whether the high protein diet works. And I know there are some clinicians in the States that work on collagen 6 disorders. So that might be a good muscle disease where this kind of nutritional therapy could work. So I know in mice it has some success, but I don't think
you remind me of some work that Nina Rabin has done. And Nina Rabin, as I quoted there, a very good investigator, she developed the knockout mouse for Pompe disease, and then she actually treated with a further knockout of autophagic vacuoles. And she had a very good response to this double genetic induced treatment in which the mice improved very rapidly and so on, and of Pompe mice. But what happened is that they died much earlier than the normal life expectancy of a Pompe mouse. In other words, she got a very good response, but they died about 4 or 5 months later. This is in the literature. It's Nina Rabin in about 2010 or something. And we've discussed this with her. And what I think is happening there is that they actually eliminated all autophagy. And autophagy is very important for normal muscle function. And what we're not doing in the way we do it is we just give nutrition and so on to these patients and exercise. But the most important is to give the protein nutrition overnight so that they don't develop further autophagic vacuoles, but they have the capacity to develop autophagic vacuoles if there is some necrotic tissue that needs to be eliminated. When you knock out autophagy, that's eliminated, all the old necrotic tissue collects and they die.
Okay, so thank you very much for a very illustrative talk, and if there are no further questions, thank you.